Well, flu season is approaching and health experts want you to be prepared.
So doctors say getting a flu shot can help you stay healthy and avoid missing work, school, or special moments with family and friends. And this also comes amid fears of another tripledemic. Joining us right now are Doctors Willie Underwood of the American Medical Association and Dr. Leandris Liburd of the Centers for Disease Control and Prevention. Nice to have you both here. Dr. Liburd, what are you seeing? Are people coming down with the flu right now?
Good morning. Actually, right now, cases are low, but we're still ahead of the flu season, which is typically between October, and it can run as late as into May. But this actually makes it the best time to get a flu shot.
Gotcha. Dr. Underwood, I know we're talking about a tripledemic. You know, when I hear all these things, I'm thinking, like, are they trying to scare me again? What's going on?
Well, no, we're not trying to scare you, but we are trying to make sure that you have the information that you need. And again, sorry, thank you very much for having us on the show. So we need to make sure that the public is educated and understand the risks so that they are not hospitalized, so that they don't die unnecessarily. And not only that, that they don't miss out opportunities with their friends, they don't miss out on work, and students don't miss out unnecessarily on school.
Well, Dr. Underwood, since we have you here, can we talk about the timing of this flu shot? Because we just heard Dr. Liburd say that the flu season goes from October to May. So are some people kind of suggesting maybe get it in the middle of winter?
Oh, no. Should get it now, right? So you want to get ahead of the curve. So as flu season kicks off in October, you're prepared for it, and you start getting exposed, and you can decrease your risk, like I said, of getting sick or end up hospitalized or even dying.
And Dr. Liburd, what about people saying maybe some of the myths of the fact that you can get the flu once you get the flu shot? Maybe it's because you're injecting some of that virus into you. Is that what you're hearing some people say in terms of myths of the flu shot?
It's a myth, and it's not correct. Getting a flu shot will not give you the flu. Sometimes people will contract the flu after getting the flu shot, but it's not nearly as severe as it would have been had they not gotten the shot.
Dr. Underwood, yeah, I'm sorry. Go ahead, doctor. I'm sorry. So sorry. Finish your thought.
Yeah, no, so we encourage people to get the flu shot ahead of flu season, as Dr. Underwood was saying, so they can be protected and protect their families and communities as we're going into the flu season.
So, Dr. Underwood, I'm thinking, you know, with my mom, her doctor said she can get the flu shot and the COVID shot at one time. Is that recommended? I'm just worried about side effects, risks, that kind of thing.
Well, yes. The thing is that doesn't increase your risk of having a side effect if you get the COVID update or for your first shot, and with the flu update as well. Combining them together will not increase your risk of a side effect or having any complications at all. And if you have any questions, please feel free to discuss this with your provider, and also get information from getmyflushot.org, getmyflushot.org.
Thank you. And Dr. Liburd, we were talking about a tripledemic. Where are doctors coming up with this? I mean, especially since you don't see, you know, anybody getting sick right now with the flu. I have heard people coming down with COVID. They're fine, but why are we concerned with the tripledemic?
So there are 3 viruses, respiratory viruses, that will be co-circulating this year. So one is the flu, the other is RSV, and the third is the virus that causes COVID-19. And so in order to, again, protect yourself ahead of that, the vaccinations are the best way to do that and to minimize the risk of a serious condition or a serious illness that could lead you to being hospitalized.
And I know you're talking about the seriousness of it. Maybe you might have some stats, numbers on some of the people that, you know, get seriously hospitalized from the flu or maybe even die from the flu. Do you guys have that, some of those stats?
Yes, absolutely. When we look at last year's flu season, more than 27 million people actually contracted the flu. There were tens of thousands of hospitalizations that were associated with the flu, and 19,000 people actually died from the flu during the last flu season.
Well, thank you so much for that information. I'm sure everybody's going to hopefully consider it and talk to their doctors about whether they should do it. Dr. Willie Underwood and Dr. Leandris Liburd, we appreciate you coming on Good Day New York.
Thank you.